Shall I? The answer is it's really difficult and we don't know.
Excuse me, we really can't. It's not just about who you
Okay.
Maybe we'll have to pass the mic around. Sorry about that. Thank you very much indeed. We'll try and make sure that we use it well from now on. It is true.
This is all going to go so badly wrong. The answer is, the short answer is, I don't know. The youth of any community are hard to access no matter what you do. And there's also an inverse law of care which states that the people that really need the care are the ones that are most difficult to get at, the least likely to access it. We used to run a surgery up at the community college in which at the very least we got people up to the age of 17 coming on a regular basis, and the funding for that was discontinued by Devon NHS. So we had to pull out because we weren't going to do it for free. You might argue that this series of changes puts the impetus back in the hands of GP commissioners and that we may find some more innovative ways of getting young people in the town interested in healthcare. There is a whole lot of work still currently going on through Devon County Council, but they've got their own budgetary problems, and I do know that they've had to withdraw some of the services that they were offering to the youth of the town. So the short answer is we really haven't spent a lot of time thinking about it because the bulk of our care is, you're absolutely right, I'm afraid, is focused on disease rather than prevention, and we need to work harder at that. And any ideas that anybody's got, we would definitely be prepared to look at.
Can I just make a more general point that sort of going around the room, people are flagging problems, flagging concerns that are pertinent to them that we might not necessarily see. And unless you have this sort of dialogue, you don't get those problems. We don't know about them. And equally well, unless we have the dialogue, we don't think through solutions. So it's, we're sort of sat up here as a sort of resource tonight, but you guys are the resource as well. And that's sort of the whole point, really, to find out what the problems are and then find out how to address them.
Make up a name Monday morning, 9 o'clock, ring up your surgery and say, I want a consultation with yourself and see what action you get.
Well, that's a very interesting suggestion. It's essentially what you're talking about, a secret shopper, isn't it, there?
Well, first we have actually done some secret shopper stuff. And the answer to that question is that you have a responsibility to be part of the solution as well as part of the problem. Because if everybody in Dartmouth rings on a Monday morning at 9 o'clock, there isn't a system in this universe, frankly, that's going to cope with that. And the problem we've got, in essence, is that on a Monday, 3 times as many patients will ring requesting an appointment as any other day of the week. And that's a fact. So there is a problem at Monday morning at 9 o'clock. I also think there's a reality there that some of the systems that the government have put in place about access and that we've implemented have made that problem worse rather than better. But frankly, you are part of the solution here. And if you can come up with a system that really lets us work, it's not as if we all walk into work at 9 o'clock on a Monday morning and think, how are we going to make it bloody difficult for them today? Let's have some fun and shut the phones down. Genuinely, if you really think that we think like that, then we're sunk, aren't we? We do need your help. Help us.
We do, don't we? We do.
I would suggest you come to the patient participation group or at least have a discussion about that, because the fact is we can't get any more phone lines. Can't do it physically.
So that's a big issue, clearly, getting through on the phones. What they're trying to talk to is try and find ways in which we can improve them. Obviously, get people like yourself into the patient participation group, that's part of it. We've also, hopefully, there might be other ways of doing that. Maybe we can take the pressure off the phones a little bit as well by providing other services in other ways. You can order prescriptions online, for instance. Maybe there might be ways of using things like that, which might go a long way to engaging the young people of this town by using technology in such a way which allows people to more easily access. However, I think it's very interesting. This is all good stuff. Fantastic. Okay, I'd like to go to someone who hasn't actually made a comment, so I'm going to go here and then here, please. Thank you.
My name's Christine Wade. I do think we have a responsibility as patients to use the service in a way where nobody goes into response. Never had a problem getting through to surgery for delivery on Monday morning. I've come from an area where the service in the GPs was poorly. This is brilliant, doctor surgery. You can get through. I've always been able to get a meeting either with a nurse or with a doctor when I needed to. And the doctors have gone beyond what they needed to do to help my husband and my services be moved to Dartmouth. And I'm sad to hear some of the comments. I think you could use the internet more to inform people, educate people about what to expect. If you can manage expectations of what you're going to get, then you might not get so many disappointments. Like, who do you go to if you do need help, if you've got a very seriously ill relative? That could be on the internet for those that use the internet, or a handout for those that are coping with terminal illness, which is very stressful. I've been through that with my own mother this year, and we didn't know who to go to because we didn't understand the system. So perhaps some education for people about expectations. But I think you do a brilliant job. Thank you all very much.
Christine, Christina said that she personally hasn't had much of a problem getting through because she deliberately doesn't call the surgery on a Monday morning. Thank you for that. But also is saying that perhaps the surgery could use the internet more, create better information systems to manage expectation. I don't know if there's anyone who would like to take and make a comment about that.
I suppose we're trying all sorts of different ways of communication, and part of it is having a point of access. Now, we've all got everybody's phone numbers, we've got their postal address, we've hardly got anybody's email address. And if there's a plea really tonight, I mean, anybody at all who is willing to be contacted by email, it makes our job so much easier. I mean, part of the presentation that Graham did about the stuff that we do, nobody knows about that stuff because we don't communicate it effectively, and that's part of why we're doing this as well. So please, if you can leave email addresses, that would really help us.
Well, hopefully they will. We're starting tonight. We are starting to collect emails. There will be forms in the surgery from now on, every day. If you have an email address you want us to contact, that's one of the reasons why I'm here, is to help get a monthly newsletter out. And if getting whatever information we think you need to know, and you can let us know what you need to know as well, there'll be the ability for you to contact the surgery via email, in any way you feel, but especially via email. Of course, it's easy. It's easier for us, hopefully it's easier for you. Okay.
Thank you, Carol. There is quite a bit of work going on with the use of email and general practice at the moment, and speaking to people who've sort of gone over to using email more than phone, they find that it's you get inundated with emails for the first sort of couple of months or so, and then what happens is that people actually discriminate again and it becomes manageable. So I think from the practice point of view, we have to someone mentioned about our own health and well-being, and I think somewhere in there one has to know what is manageable workload. But I think in these days of electronic communication, it's got to be the way forward, hasn't it? But it's going to have to be an educational thing around what information people put in their emails. And then, of course, then you get groups that don't fit in with email, who can't And it's very important that we don't leave them behind. I think the good thing coming to the youngsters is that that's actually their preferred method of communicating. So I think, you know, from a contacting that 12 to, I don't know, 18 age group, I think electronic communication using even high. Okay. But they're a particular group, and they have particular needs, and trying to engage them is challenging, but less challenging maybe with the electronic stuff than it has been in the past. So I think watch this space about that.
Phil, we're happy to carry on for a bit if you want to. Yeah.
Brilliant. Okay, so yes, sir, please.
Me.
Yes.
There may be a question somewhere. You've talked of change, you've talked of care, you've tried to define it. I think it's very important to identify and realise what is not going to change. And what is not going to change is that what patients really expect from the general practitioner is caring. Now that is caring, not caring defined by a spreadsheet, by a tick box, by targets, by cost, by budget, by the running commissioners. It is caring for one person for another. And that is not going to change. The only thing that's going to change is people are going to be roughly ill in the same sort of way. So in a lot of mini specialities, and actually I think we probably underplay your mini specialities, they're very useful. But it's still general clinical care, and it's very hard to put on a grid and define it. But it still comes under that sort of overall umbrella of caring. And I think general practice in India is losing that. It's gone from 24/7 to 12/5. Emergency care at night, we've had a few instances of that, it's disappeared. GP contract is very restrictive. You've lost touch really with liaising with hospital specialists, clinicians, entirely civil services. I think whatever the practice develops has, it's got to be in the hub of local care. We've had quite a few instances here tonight of fragmented care with other agencies, the internal care, the health care, and all that. And all it used to be, and I speak from memory, part of the general practice bubble. And you've got to restore that general practice caring bubble. You are the caring professionals. You are not the professionals for ego toenails. You are caring professionals. Sorry, there wasn't a question.
I'll see if I can
The
get...
question really is how you can restore, I think, the caring of general practice as a whole.
Okay. Sorry, sir, what your name was, sir?
Paul, you guys.
Paul. Paul has asked, essentially, has referred to maybe the old-fashioned way, perhaps might be a good way of putting it, of GP caring and that kind of very clear sense of a relationship between a doctor and a patient, and has asked whether or not, I think his question whether or not that is still there. And it said that perhaps it's being defined more by targets and spreadsheets, and maybe that takes away a little from the caring, perhaps.
Can I just...
But he's asking how are these GPs going to ensure that that's still there?
I appreciate it's not a question, it's more sort of a comment, but a lot of the changes that's happened over the last few years have been hoisted on general practice. We had no choice in doing all the bean counting. We've had no choice about not being able to do out of hours anymore. All of that has been hoisted on us from above. And as Graham alluded to right at the start, that our number of patient contacts now is infinitely greater than it was 8 years ago. And the number of things that we are asked to do is every year is greater and greater and greater. We're being asked to do all the pre-operative assessments for patients going in for hospital, for operations now. So it would be nice to go back to, I wasn't a GP 20 years ago, but it would be nice to go back to 20 years ago when we had the time, when we had the capacity to do all those things that we now, that we didn't have to do all the things that we now have to do as well. So I think I completely take on board your point about, not losing sight of the basics and not losing sight of the fundamental job that we're having to do. I think general practice struggles under the expectation of everything else it's had to do as well.